I guess just thinking from what you said, you talked a lot about people with disabilities advocating for themselves and advocating amongst each other. And I guess we were talking about statistically occupational therapy students and professionals are most likely able-bodied individuals. And so I'm wondering if you can speak to what you wish would happen with the healthcare system and with able-bodied people trying to advocate for you. What would you like to happen, or what would you like to see able-bodied people doing to support and empower you and people with disabilities in the community?
I think maybe partnering with the community. I think access to healthcare is still an issue in terms of physical accessibility in healthcare settings. I know with some of the healthcare staff we have here at Access Living, a recent campaign of theirs was trying to get more accessibility within clinics and things. So like examination tables, scales, things like that. And, making sure that people, just like someone in a wheelchair, could use a scale or could get the support they need to be transferred onto an examination table, or get examination tables that are physically accessible, so that wheelchair users could either transfer themselves or transfer with assistance in an easier way. So I think looking at the physical environment themselves and trying to create affect the creation of more accessible clinics and just accessible equipment in hospitals and in medical outlets around the city. Because I think historically, an issue has always been like, I always thought there was like one. I think there was a clinic at the Rehab Institute of Chicago, and that was like the one like really good accessible clinic in Chicago. And so you'd have people with disabilities going to other clinics like in their neighborhood or something like that, and maybe they could even access those clinics, but they would be sent, they would be told by the attending people at their neighborhood clinics, like, oh no, well the one downtown is the accessible, you should go to that. But they didn't want to, they wanted to go to the one in their neighborhood. Or you had clinics with equipment that was not accessible. So as a result, basically what you had was like a lot of people with disabilities not getting regular checkups and things because they were kind of turned away, or they were told they should go somewhere else, but they didn't want to go somewhere else, and so maybe they just don't go, or they go for a regular checkup, but they can't do some of the basic what are the basic things you get done when you get it, you get weighed and blood drawn and things like that, and you can't get that stuff done because of inaccessibility. I mean, that could create problems down the road. So I think kind of partnering with the community in order to get more access is one thing. I think that the healthcare community can do. But then also kind of working together on policy issues, which policy issue could very well be legislation to that would kind of legislate the creation of more accessible equipment and accessible clinics and things like that. Plus ensuring that people have other accommodations. Like sign language interpreters, maybe. I think that's been an issue. I think hospitals and offices are expected to provide that. But I don't know if there's an awareness of that, and I'm sure there's examples of where it's not happening, and so then communication becomes a significant issue between the patient and the medical provider. So I think those are some areas, but also doing what can be done to because there are people with disabilities out there who want to become doctors or who want to become occupational therapists or other things within that industry. I should send you a link to when we gave Rush that award last year. We made this tribute video for them, and all it is these different kind of commentaries from people who work at Rush, and at least one, maybe more than one of whom are people with disabilities on staff at Rush. So Rush has even made the effort to not only be inclusive of people with disabilities who come there as patients, but also as people who come there who want to work there. So that's another area. Is like what can we do to make these programs more accessible to people with disabilities, more inviting to people with disabilities. So yeah, I think those are some areas that come to mind. And in continuing what we do, our healthcare policy staff, none of whom are here today, unfortunately, but they often, in particular, work with UIC and occupational therapists or students there. So that's another option, looking at disability groups and partnering together on projects. I think some work that they've done before is mostly, I think, been research of people with disabilities transitioning out of nursing homes and kind of what that experience is like, what the needs are when they're in the community, and are they getting those needs? How many people wind up back in nursing homes because those needs aren't met? But I think that's another opportunity, is looking to partner with disability groups in Chicago on different projects. Yeah.
Okay. Mm-hmm. Do you have anything specific you wanted to ask as well?
Yeah, you covered a lot of
I
stuff.
think definitely similar. Or
That's
it's kind of similar.
Yeah, I guess.
I don't know. That's kind of covered.
I know you really did a really good job of
Yeah.
answering all our
good.
questions
All
without
right.
even asking.
No.
I guess. Yeah, I guess if we can just ask if there's anything else, like if you wanted to say one thing to occupational therapy students or one thing to healthcare providers that you think that they don't hear in their curriculum, what would that be?
Well, I'm not too familiar with the curriculum, but I think what comes to mind immediately is doing exactly what you're doing. Make sure in that curriculum you hear directly from people with disabilities. You don't hear about people with disabilities from, a textbook or from, medical professionals telling you about people with disabilities, even if that professional might be disabled. But yeah, go and talk. Hear directly from people with disabilities about their experience at hospitals or in clinics, or getting services in the community, because I think that's and again, look for opportunities to work collaboratively on pieces of the curriculum or on projects, because I think that's the best way, whether it be disability, whether disability is the issue or the or be other communities. That's always the best way, is hearing directly from that community and trying to get a sense of what it's like and what the barriers are and what the opportunities are. So yeah, so more of this. So I appreciate you coming directly to Access Living and talking to people. Yeah.
Yeah, thank you.
Yeah, thanks a lot.
I feel like, I learned a lot, and I feel like you have a lot to say, so I'm really glad that you were willing to meet with us.
Yeah, and I
appreciate
thought
that.
Michael was going to come. So Michael's someone who's moved out of a nursing home